became interested in the SAFE programs after I attended the Royal College meeting last year, where I went to a study afternoon workshop on SAFE. SAFE stands for Situational Awareness for Everyone, and it recognises that everyone involved in the care of children has a role to play in their safety. This is a program that's been running for a year and a half. The aims are to reduce harm using some of the tools to help identify deteriorating patients and to respond to their deterioration. And it seemed like the next step to use the tools that have been developed by the SAFE program at our hospital to improve our safety culture and to help us become a safer organisation. And so we had launched our new Paediatric Early Warning Score in April 2015. We also have regular handovers. And we have an attending consultant of the week.
Using data for improvement all the time, so not just doing it for the purpose of your project, but also continuing that to make sure that it's continuous and sustained. And then I think always adapting the process, because things always change in a hospital. So if you can't adapt your process in a year or 2 years' time when things have changed a little bit, then you find that things drift. But actually, if you keep adapting, if you keep continuing to improve your process, you find that it actually gets better and better. So it's not just a short period of time where you do SAFE, it's actually you do SAFE all the time for the foreseeable future.
What was nice about SAFE is that we were able to benefit from tools that were being used in other hospitals, and one of those tools was the safety huddle.
Pew scoring we always did do, but I don't think we got together and actually would really talk about the pews. So I think that way it's really incorporated it. It's what I look forward to actually in the morning, so I know what's happening with all the other patients. So I feel like especially ringing the bell, getting everyone together.
So the safety huddle is a multidisciplinary short meeting that's held at a regular time every day, attended by everyone involved with the patient's care on the ward. So that would include people like doctors, nurses, pharmacists, play specialists, and adult health professionals. The purpose of a huddle is to consider the safety of each individual patient by looking at their pew score, their early warning score, and if there are any other risk factors, for example high-risk treatments, if there are any parental concerns, staffing concerns, or any communication issues.
Huddle is very helpful because now when we huddle we know the views of the patient, if the child needs more help, and in this case if we see the observation, like if the observation is like we put like yellow and green and red. If it is red, it means that he has a serious abuse level, and in this case he needs more observation.
We've got lots of tools in place, and we've audited our practice, so we make use of safety crosses, which gives us a visual guide. So we have a safety cross for whether or not a huddle has taken place. We have also formally audited our huddle process, so we know that we are reliable. We have a regular huddle that happens every day, and that is attended by the right people, that we are reliable in recording our observations, that we calculate our scores correctly, and that we escalate according to the action plans for elevated pew scores. I think that it's really important for something like SAFE to work, that you have strong nursing and medical leadership.
It gives everybody a daily, it's almost like a kind of mini MDT of the patients on the ward each day, which I think is really handy because everybody's got a chance to put some input in. It means that you know what's going on with each other's patient.
We have also done a survey of our staff's views on how safe our ward is, and we plan to do this as an ongoing, regular survey. We couldn't have introduced all the things we've done without the goodwill and the enthusiasm of my team.
From the point of view of patients, it's really, I like the SAFE board, it's really informative for parents. It shows them that we take their children's stay on the ward quite, it's quite important.
So that it's embedded in everything that we do, that safety is our business, and that is foremost and most important